My name is Kathryn and I am the Healthcare and Clinical Assistant at St Martin's Medical. Yeah, so my mum is a nurse at this practice. She was also a midwife when I was growing up, so I had a lot of exposure to healthcare through her. I also previously worked at the hospital for around 10 years as a cleaner. And so healthcare has always been something that's interested me in that aspect. Basically I go through and I will comment on all the inbox documents with a quick summary of what the document is about. I will also make sure to write who it's from, and if there are any documents that are in the wrong provider's inbox, I will move them to the correct place. If there's anything that the GP needs to follow up on, I'll include that in the notes. I will also make sure that the document says who it's from, so that just by looking at it they can see where it's coming from, and when it goes into the patient's file we have a quick summary of who it's from and what the document is about. I will also add classifications for any injuries or any operations or new diagnoses that come in, and add maybe ACC accident numbers and immunisations as well. I'll add into the patient file. The clinical assistant role is about 10 hours per week. But that varies across each day as to how much time I will spend on inboxes. Days like Monday, where we've had 2 days before when no one's checked, I will spend maybe 3 or 4 hours, but then a Wednesday or Thursday it might only be an hour, hour and a half. It was all very on-the-job training. I had a few sessions with Lizzie, basically explaining what I was to do and the protocol that we would keep to. There was a document that was created that we used as the guideline for what I would do with each document that came into the inbox. Say if it was a breast screening notification, it includes guidelines as to what I would do with that if it's a normal result, and what I would do if it's an abnormal result. And slowly we just began adding tasks onto my job as I became more confident. I still meet with Lizzie, going through anything that I missed or anything that I need to improve on, or if I've got any questions. So I work alongside the nurses. I work in the nurses station, so if I have any questions about a diagnosis or about what a document says, I can ask them. And yeah, I've basically just been learning from them because they've just been able to explain something really quickly because they're right beside me, rather than having to wait when I can meet with Lizzie or when Lizzie's next in or anything like that. I would say don't be afraid to learn, because there is a lot of learning involved. Don't be afraid to ask questions. Always rely on the people around you. I love administration. I love my workplace. Is another thing. I do enjoy working with my colleagues. I love how varied it is. I love the challenges that it provides. It's not a straightforward or easy job, and I love how much I've learned and how far I've come since I started doing this. It reduces the amount of time that doctors have to spend on admin. It also means that all the notes and documents that come in from outside of the practice are more organised, and it's easier for doctors to find things when they're in consultation with them or when they're preparing for the consultation. Everything is laid out. I know for me personally, I do a lot of classifying, and I do find it difficult when we get patients from other practices where there are no notes, there is no organisation, and it's quite difficult to go through all those documents and try to find the ones that we need to for the patients. So yeah, I think it is a great time saver for the doctors and allows them to spend more time caring for the patients, which means the patients get better care and the doctors aren't as overworked.